The People's Zoom Readers Theater is focusing on the problem of addiction to reinforce the message that there is no shame in the struggle and in the possible setbacks. Recovering from addiction and compulsive behavior requires willingness and courage and a lot of support. Getting help and encouraging each other is essential. We and our loved ones who are struggling and those whom we've tragically lost shouldn't be defined by this problem. There is so much more to each of us that we want everybody to know. And those who are still striving are worthy of our help, worthy of our understanding, and worthy of comprehensive assistance from our government, our schools, our community centers, and houses of worship. Tonight, we are sharing some of our stories and providing information about the causes of addiction, therapies, and resources that we hope can be beneficial in some way. At the end of our presentation, we welcome you to share your thoughts and your experiences.
One day,
1 week,
3 years, and clean 5 months.
I'm here, but I don't know how long I can do this.
For those of you who are new today, this is what we hear when we are sitting in a recovery group meeting for addicts. I'm Maya, a member of Narcotics Anonymous, a support group, and this week it's my turn to be the leader. I just want you all to know how grateful I am to be here. And I'm happy to welcome those of you who are joining us for the first time. And of course, welcome loyal members. Well, you know me and I know you, and I'm really glad to see you and hear how you are doing. I realize from my own experience just how challenging it is for you to come. It's still challenging for me at times. I'm proud of all of us who do this. We know it takes a lot of courage, determination, and strength to get through another day, another week, another month. Whatever your achievement is, do not minimize it. It is an achievement. Now, let's hear how you're doing.
Hi, Maya. You were right. Rehab was the right place for me. I'm sorry it took so long to get there, but I found myself again and found a genuine determination to stay clear of anything that tempts me. Anyway, I'm glad to be back here with all of you.
Carla, we missed you. Really glad to see you again. Who's next?
I guess I am. Well, I'm new here. I'm not even sure how long I can stay. I'm not used to this kind of thing. Does being here really help?
Hi, I'm Aiden. Glad you came. For me, it's just knowing I'm not alone. Yeah, this helps me. When I see people like Tina and Kai fighting this for a few months and still here, yeah, I see you, Tina. See you, Kai. You're still here. Well, seeing you guys gives me hope. It will be great if seeing us will give you hope.
Thank you, Aiden. I'm Jake.
Hello, Jake. Would you like to tell us what brought you here?
Sure. I didn't think I had a drinking problem. It was obvious to others. I was in denial. Actually, it was my little daughter who made me realize I needed help. And it was a good friend of who I see across the room who invited me to come here. Thank you, Matteo.
Glad to see you.
Hi, I'm Reina. For those of you who I haven't seen before, I know it's been a while. Frankly speaking, I was very busy tending to my patients, forgetting to take better care of myself, and my pride dominated. I made the mistake again of thinking that just a pinch of the substance would get me through those tough days. But as you can imagine, that didn't work.
Wait, you have patients? Are you some sort of doctor or nurse?
Yes, I am a doctor, and just like anybody else, I'm not immune to addiction. I think you might be surprised to know that doctors who specialize in anesthesiology are particularly prone to opioid abuse, like fentanyl or subfentanyl. And of course, there's also alcohol abuse. For example, surgeons have a high percentage of alcohol abuse.
I guess the pressure must be tough.
Yes. I went into a profession I really love, but people expect me to be a miracle worker, and when I'm not, I'm tough on myself, and perhaps more than the patients and the family members who expect me to be a god. But enough about me. I'm grateful to be here.
I'm glad to see you, Reina. I was worried about you.
No surprise, you're being a psychiatrist.
Yes, I'm the one who's supposed to help people with their emotional problems. Problems that can often lead people to substance abuse. Well, I'm not proud of myself, but there is a limit to what a person can take without breaking down. Since the pandemic and the last election, well, there's just aren't enough hours in the day to accommodate my patient's needs. Leave a day off? It's impossible without feeling such guilt. Things got so bad. I had to spend a few weeks in rehab. Yeah, I feel terrible about my patient, but I had to relearn some of the things that I needed to do to save myself before I was in a position to save anybody else. And you know what? I think my patients understand that.
Alvin, so glad you got the help and the rest you needed. You look much better than you did the last time you were here.
Thank you, Maya.
Hi, I'm Olivia. Actually, I'm not here for myself. I hope you don't mind. Thank you, Maya, for giving me permission to join you. I hope it's okay with the rest of you. I'm here because of my daughter-in-law. I came because I genuinely want to understand.
Yes, of course. So I thought this once wouldn't hurt anybody. Naturally, we wish your daughter-in-law were here, but since you made the effort to come here, well, we really appreciate your desire to understand. Am I right? Are you all okay with this?
It's okay. Yeah.
Yeah, it's okay you're here today, but I hope you will join us later for our circle of family and friends affected by addiction.
Thank you. I'll certainly do that.
It's so nice that you came here. I wish somebody in my family would come to anything. Nobody at my home gets this. To them, I'm just a terrible disappointment. Some members of my family call me a devil. I'm a hopeless loser. I'm killing my mother and destroying our home. And you know what? That description is right. I am a devil.
Terrell, that is not who you are. Your addiction is not you. There's so much more to you. You're the victim of a terrible disease that can destroy a person. But we believe that with help, things can change.
I've tried to get help. I have, and not just once.
I know that, Terrell. I know. I'm not criticizing you. I'm just reminding you that you shouldn't put yourself down. That's all.
I don't care if it's 10 or 20 times. We can't give up. We just have to keep trying.
Thank you, Aidan. You're so right.
I'm Nate, the group therapist. I'm very glad to see many of you here for our family and friends group meeting. I assume that since you're here, you have a family member, a friend, or a colleague who's struggling with addiction. And I understand that you could be suffering too. Chances are you're stressed, maybe even angry at times, frustrated, impatient, maybe even confused. And if you're trying to cover it up, you know what I mean. Lie to those around you for fear people will judge, maybe even condemn, even ostracize the person who has an addiction. Well, if that is you, you must be exhausted.
That is such an understatement. I am totally drained. I am here because I'm at loss and I don't know what to do. I don't know how to help. And to be honest, I'm scared.
I understand. You have a right to be all that you're feeling. And sometimes you may think, why can't she just do the right thing? Be more disciplined, more responsible. Why can't he just stay away from those bad people and get the help that's available?
Yeah, why wouldn't he just get up and go to that rehab center and get some help? Or at the very least, attend a meeting like this.
Well, I really don't want. No, I agreed to come here. You know what? I'm just sick and tired of hearing all about this disease stuff. They can't help it. It's a disease. For God's sake, does anyone have it? Everyone has type of disease these days. When I was a kid, I was sad all the time. All I said was just get over it. You know what? I pulled myself up. I got over it. Nowadays, there are all these support group things, therapy, so-called counseling. Jeez. Who twisted your arm to take all these drugs anyway? Before she drink so much and make other people's lives so miserable. Huh? I'm tired of these bleeding hearts. I'm tired. Grow up. Start acting like an adult and take control of your life. Stop blaming everybody else except yourself. I'm done.
We hear this a lot. You're not alone with these thoughts.
Nope, you aren't alone.
We're all just human. All of us here today, just human. Our feelings of frustration, even desperation, are normal. If we didn't feel upset, angry, even helpless at times, we wouldn't be human. We also know that living with these feelings without talking about it can be unhealthy, emotionally and physically. That's why we're here, and that's why we are very glad you are here. The hope is if we can better understand the problem, we feel less alone. If we better understand the cause and the challenges of overcoming addiction, we will come to accept that there is no shame. There is no cause for judgment of your loved ones, your friends, your colleagues, and there is no shame for what we are feeling. We are doing our best to help. So please feel free to share your situation. Tell us who you are and your relationship with the person who is struggling or who struggled and tragically didn't make it.
I want to share. Can I? Is it my turn?
Please, indeed.
Thank you. I can't help but recall a conversation I had many times with my daughter-in-law. I've even written it down. Can I read it?
Sure. Maybe Jane, who is sitting next to you, would take one of the parts.
Glad to.
Oh, thank you. You can be me and I'll be my daughter-in-law, okay?
Action.
Please leave me alone.
I can't.
I'm just tired. I just want to be left alone.
I can't leave you alone. I love you. We all love you. You have a baby, a child to take care of, a beautiful baby. Please get up, wash your face. You'll feel much better. You'll see.
I'm too tired. I just need some more sleep.
You've been sleeping for 2 days. You need to get up. You have a good job. You're gonna lose it. They won't keep waiting for you. Please, please just get up. You can't live like this.
I know. I'm just too tired. I must be sick.
Is there something they gave you that you can take that will help you?
I took it. Maybe I took too much. I don't know. I don't know.
I don't know what to say. I just don't know how I can help you.
I'm sorry. I'm so sorry. I'm trying, really trying, but
I'm very sorry too. I only know you're going to lose everything. Your son, your job. My God, you have so much to be grateful for. You are so lucky. Don't you see what you are doing? You're just throwing it all away.
you think I don't know? You think I want to be like this? I don't want to lose everything that means the world to me. My life is nothing without my family. But just, I can't seem to get myself out of this. I'm sorry. Thank you. Thank you for coming here. Well, that was the end of many conversations we had over the years.
Mm. Thank you, Olivia and Jane. Are you okay?
I'll be okay. Just give me a minute, please.
It all sounds too familiar to me. And it's so upsetting.
Yeah, I'm afraid it's a very familiar conversation, and there is nothing good to say about it. So tell us, Olivia, did your daughter-in-law ever get help?
Yes, 4 times in rehab. Every time she left, she felt empowered, even excited. We were all so relieved and anxiously optimistic. But, but
Would you like to tell us what happened?
sure, after 10 years of ups and downs, she seemed to be doing really well. She even started a new business. Perhaps the pressure was too much. I honestly don't know all the details. I just know that when she texted me, she seemed so very much in control. I can only assume she must have needed something to calm her, to help her, or to help her sleep. Her struggle with depression must have been too much. She took something, but the police, well, they believe it was not what she thought it was. The police said it was fentanyl, something they believe she had never used before. They called it homicide. I keep asking myself, why did she take anything that could hurt her again? Clearly, it doesn't matter now. She's gone, and I just can't accept
Mm.
it.
Sorry. I'm so terribly sorry.
Yeah, I can't listen to a beautiful song, the one that makes you smile, the one that makes you want to dance, the one that triggers special memories. Well, I hear those songs and I'm just crying. We lost a beautiful, talented woman, the mother of my grandson. She really did have so much to live for. And I know she tried very hard. And she was like a fragile butterfly that just wasn't strong enough to fight the depression, that it caused her to seek the wrong kind of help. And it consumed her mentally and physically.
I get it. I know your pain. We lost my middle son, Randy. The joy of waking up to a sunny day is gone. As soon as I remember that Randy will no longer experience such a day, I just want to curl up with my pillow and cry my heart out. A feeling of guilt comes over me. Yes, guilt. Though I honestly don't know what more I could have done. I thought about this. I guess I just feel guilty that I can still see the sun, enjoy a swim in the pool he used to swim in. Oh, and so much more. I can still live this day, do all the things that Randy liked to do, eat the ice cream he so enjoyed, and he can't. And I just can't stand it.
Like you, it's very hard to pass the day without cheering or screaming, no, 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 it can't be this. It shouldn't have happened. How did we let it happen? What could I or what should I have done to prevent such a terrible loss? He was my brother. I miss him every single day.
I hear you. We hear you, Dante. Olivia, we hear you. Jane, these are real feelings and thoughts that are often felt in reaction to any loss, especially of a young person. Quite honestly, there seems to be a unique pain that comes from the death of a loved one, a friend, a colleague, a neighbor, even an adored celebrity who succumbed purposely or accidentally to some form of addiction. And unless we can understand the journey of an addicted person, it's hard to accept the fate without feeling a sense of responsibility.
Yeah, I'm Les, and I'm not an addict, but my life has been profoundly affected by loving an addict. At times, I want so desperately to stop caring because caring for a person who is totally unpredictable and frequently irresponsible can be extremely stressful. Is there another word for stressful? It just doesn't seem to cover how I feel. I'm constantly disappointed after another broken promise, another emergency that puts my life on hold. When another catastrophe has been averted, a stay in rehab gives respite from endless worry, and there are the signs of life, reasons for hope, and a version of a normal life seems possible again. It is so beautiful, a time for celebration, prayers answered, a period of relief, even gratitude. It's even possible to believe in a future together, and then, and and then your guard is down. You begin to feel that something isn't quite right. You hope with every fiber in your body that you are wrong. It's something else. You're being too sensitive.
Yes, I know, Les. I know what you wish it were: a cold, the flu, an allergy, a simple bump in the road, a one time mistake, a brief slip or relapse. But it turns into something much worse. And then the excuses, the untruths that turn into a string around your head and your heart, and you don't know how to function. Well, I'm not even sure if I can keep my own job, handle my own responsibilities, and feel good about anything. For me, it was headaches, upset stomach, and sleepless nights. Endless questions about the future plagued my waking hours. The love you have is shaken. Sometimes you try very hard to recall the good times and why you love this person. You never stop caring, but you hate your life, and you can't but wonder how you can keep going in this relationship.
That's right. You want the pain to stop, but not if it means losing this person who holds your life in her hands.
validating your feelings, your experiences. This is the purpose of our being here together. No judgment, no shame. We are here to help empower each other and help however we can.
Oh, Nate, thank you so much for inviting me here today. I just wanted to say hello to everyone. My name is Dina, and my heart goes out to all of you. I do hope that my recovery story can give you all some hope. So, I remember waking up thinking that my life was over. It was the day after my 4th DUI, driving under the influence of alcohol. I had done it again. I had calmed my hyped up nerves and adrenaline rushes during a family party with alcohol. This time, I caused a major car accident. I ran into the back of a car that had a pregnant woman in the front and 2 children in the back. It was a miracle that I didn't kill anybody, but I didn't know if I had severely hurt any of them. This was my rock bottom. I may be going to jail. After each DUI, I would agree to get help, go to court-assigned meetings, and jump through all the legal hoops. I could afford good lawyers, and I was a good citizen with a good job, who had family members who would show up to court or write letters extolling my character. But even after 3 DUIs, I still didn't take full responsibility for the impact of my alcohol addiction on my family, my husband, and others. I really had no clue what it would take to recover, to really get well. I'm one of those people that thought that I could stop drinking on my own. I was definitely addicted to the idea that I could do things in my own strength because I was smart. I was capable. Now, after this accident, I was finally ready to get help, to get sober, to start to look at what got me to this terrible place. I was afraid that I hurt people, afraid that my drinking could actually cause death. So this time, when I started attending an AA group every morning online, I was more willing to see my problem was much bigger than I could handle on my own. With the help of other kind women in recovery, I started to look at why I drank. What was going on underneath my drinking was a lot of anxiety that I had since I was young. I didn't know how to deal with uncomfortable emotions, so I opted to numb them instead through overachievement, overactivity, overdrinking, overdoing everything. And I still thought that somehow I could address all of that on my own. I had tried all kinds of self-help in the past, but without a full surrender, my drinking only escalated. I've always been a thinker, a scientist, so I like to use my mental strength much more than my feelings. Now, I didn't even see a reason to feel one's feelings. I was going to have to find a completely new way to live. Alcohol had been my close friend for so many years. It helped me relax, have fun, be the life of the party. I didn't realize that alcohol was my enemy and that I needed a power greater than myself to see that. In Alcoholics Anonymous or Narcotics Anonymous or with any addiction, one is asked to be willing to turn their lives over to a higher power of their understanding. Some call this higher power God. I hadn't more than a mental understanding of God, not an experience. So this wasn't much help initially, and I had a lot of resistance. I was accustomed to getting things done on my own. Then one day, a woman said to me, either there is a God who is able to help you, or there isn't a God that's able to help you. There isn't just a little bit of God. Wow. Somehow that concept was a turning point for me. And I was able to see how often I did things in my own strength. And I was finally willing to try out this surrender to God thing that so many spoke of, I returned to that turning point concept again and again. And I can tell you that learning to trust in a power greater than myself is what changed the whole course of my life. I have to practice this trust every day. Well, because my legal case was long and drawn out, I lost my license, I was on house arrest instead of going to jail. And I didn't have any knowledge through this whole time if I severely hurt anyone in the accident. I didn't know what the consequences of my actions really were. So I just had to keep surrendering over and over my fears, my pride, my willfulness. And these 5 years have not been easy for many reasons, including my husband's decline with dementia. But no matter how difficult my life circumstances are, I remain sober. And I have 5 years this month. I'm feeling my feelings, and that can be very uncomfortable, sometimes excruciating. I often wake up with anxiety, and I have to be willing every day to shift my mental patterns and practice new behaviors. I've found new ways to calm my hyped up nerves and address my perfectionistic ways. I gave up over contributing, over planning, overdoing, and trying to save other people. I'm experiencing what the serenity prayer asks. God, give me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. My higher power shows up for me sometimes in amazing ways. God has gone from a good idea to love I can feel.
Mm.
Wow. Thank you, Dina. Thank you so much for coming and sharing such a personal, honest, and inspiring journey. Okay. Before we move on to the information sharing part of our meeting, I want to thank all of you who shared your thoughts, your feelings, and in many cases, painful experiences with us today. It's so important that you know you are appreciated for your courage and your generosity. Your stories can only help those who are feeling alone and scared. Hopefully, the information that we will now provide about addiction will also be helpful. So, we've invited Dr. Frank, Dr. Menendez, Dr. Yang, Nurse Carrie, and Nurse Emma to enlighten us about the different types of addiction, the causes, the prevention of addiction, and the help that's available. No need to take notes. We'll provide on our PZRT, our People Zoom Readers Theater website, comprehensive versions of the slides we will share with you now.
Glad to be here with you. We are ready for your questions.
What exactly is addiction and what causes it?
It's a condition that involves compulsive behavior, like taking a substance or performing an activity, despite negative or harmful consequences. Addiction can significantly impact your health, your relationships, and your overall quality of life.
So, if I can't stop looking at my phone, is that an addiction?
Good question. Actually, there are two main forms of addiction: substance use disorders and behavioral addictions. Addiction to technology is a behavioral addiction. Fortunately, we know both forms of addiction are treatable.
Is addiction a disease? I've heard different thoughts about this.
Yes, addiction is a disease. The American Society of Addiction Medicine, the ASAM, defines addiction as a chronic brain disorder. Unfortunately, we too often hear people referring to an addiction problem as one that is easy to remedy with just a little discipline. I want to emphasize the fact that addiction isn't the result of a lack of willpower or poor decision making. A person's brain chemistry changes with addiction.
About these two groups of addiction. First, let's look at substance addictions. Substances can be prescription medications or non-medical drugs or alcohol, and include many things you are probably familiar with. Take a look at the slide.
While these substances are very different from each other, they all strongly activate the reward center of our brains and produce feelings of pleasure. So, use of these substances can lead to substance use disorder, SUDs, but not always. So, SUDs can be mild, moderate, or severe. Addiction is the most severe form of a substance abuse disorder. And behavioral addictions and other compulsive behavior conditions like OCD, which stands for obsessive compulsive disorder, and bulimia nervosa can occur with any activity that's capable of stimulating your brain's reward system. And there are potentially addictive activities like gambling, eating, shopping, shoplifting, or any other risky behaviors. But today, we are just going to focus on substance addiction.
Substance addictions, you probably won't be surprised to know that alcohol use disorder is the most common substance addiction in the United States, followed by nicotine and marijuana.
What are the signs of addiction? I guess if we know that, we can possibly nip things in the bud, right?
Well, that is the goal. But as you probably know, it's not so easy to detect, and symptoms of addiction vary from person to person based on the substance or the activity. Please take a look at the next slide. Some people have an inability to stop, increased tolerance for the drug, intense focus on the substance or activity, lack of control, personal problems and health issues, withdrawal.
Life being as stressful as it is, you would think everybody should be addicted to something to ease the pain, anxiety, and fear.
I agree. So, what exactly causes addiction?
The truth is, there isn't a single cause of addiction. It's a very complex condition. But we do know that a significant part of how addiction develops is through changes in your brain chemistry. Substances and certain activities affect your brain, especially the reward center of your brain. Humans are biologically motivated to seek rewards, and often these rewards come from healthy behaviors. When you spend time with a loved one or eat a delicious meal, your body releases a chemical called dopamine, which makes you feel pleasure. It becomes a cycle. You seek out these experiences because they reward you with good feelings. They send massive surges of dopamine through your brain too, as well as certain activities like having sex or spending money. But instead of motivating you to do the things you need to do to survive, like eat, work, and spend time with loved ones, such massive dopamine levels can have damaging effects on your thoughts, feelings, and behavior. They can create an unhealthy drive to seek more pleasure from the substance or activity and less from healthier activities. Over time, the substances or activities change your brain chemistry. and you become desensitized to their effects. You then need more to produce the same effect. For some substances, such as opioids, the withdrawal symptoms are so severe that they create significant motivation to continue using them. The general causes of addiction are genetics, mental health conditions, and environmental factors. Let's look at genetics. Studies show that genetic factors are responsible for 40 to 60% of the vulnerability to any SUD. Mental health conditions. There's a strong link between addiction and mental health conditions, such as depression, post-traumatic stress disorder, PTSD, and bipolar disorder. And then there are the environmental factors. Access to substances is a particularly significant environmental risk factor. Including use of substances by a member of your household or your peers, or being prescribed medications that can be misused, such as opioids or stimulants. And finally, adverse childhood experiences, ACEs. That also can play a role.
How can we tell if we have an addiction? How are addictions diagnosed?
Well, so there are actually tests to diagnose the disease. For example, to diagnose addiction, a healthcare provider may refer you to a psychiatrist or a psychologist or drug and alcohol counselor. Or maybe your provider will ask you and possibly your loved ones questions about your patterns of substance use or problematic behaviors. Also, your provider may want to do a physical exam and may request blood and urine tests. These are tests that can give your provider information about your overall health. They can also help rule out underlying health conditions.
How are addictions treated?
Your healthcare provider may recommend a combination of treatment options, including the following: hospital management, special hospital units practice monitoring and therapy to care for you while you go through substance withdrawal. Medications. Certain medications can reduce urges, cravings, and ongoing withdrawal symptoms. Rehabilitation or rehab. Providers offer structured counseling, education, support, and encouragement during rehab. Therapy. Your provider may recommend types of psychotherapy, talk therapy, like cognitive behavioral therapy or group therapy, and support groups. Many people manage addiction with the help of a support group, such as Alcoholics Anonymous or Narcotics Anonymous. Groups like Al Anon support family members and friends of people with substance use disorders.
I believe in the approach that Alcoholics Anonymous, AA, and Narcotics Anonymous, NA, use. It's the oldest and best regarded method of addiction treatment. Perhaps you've heard of the 12 steps of AA or NA. The steps of recovery are not linear. You might master a later step before an earlier stage. You might struggle with one and not others. Take a look at the slide for the 12 steps. Step 1, honesty. Step 2, faith. Step 3, surrender. Step 4, soul searching. Step 5, integrity. Step 6, acceptance. Step 7, humility. Step 8, willingness. Step 9, forgiveness. Step 10, maintenance. Step 11, making contact. Step 12, service.
What is the outlook? What is the future for people who are addicted?
With treatment, many people manage addiction and live full, healthy lives. But recovering from substance use disorders and behavioral addictions isn't easy. Supportive friends, family members, and healthcare providers can play an essential role in effective treatment. Without treatment, as you probably know, addiction can cause serious health issues, even death. It can damage personal relationships, lead to financial difficulties, and cause legal problems. Untreated addiction also harms family members, and the effects can last for generations.
Can I prevent developing an addiction?
There are steps you can take to reduce your risk of developing addiction, including avoiding or limiting substances that have addiction potential. Knowing your family history, talk to your healthcare provider about ways to lower your risk of addiction if addiction is in the family. Healthily managing stress. The risk of substance use increases greatly during times of stress and change. Use coping mechanisms during these times, such as exercising, meditating, or learning a new hobby. Consider seeing a mental health professional.
How can I help someone with an addiction?
It can be very challenging or stressful to learn that someone you love may have a behavioral addiction or substance use disorder. Here are some tips to help your loved one and yourself. Speak up sooner rather than later. The earlier a person with addiction receives treatment, the better. Practice empathy. Even when you don't agree with your loved one, listen thoughtfully to them. The more your loved one feels heard, the more they'll see you as someone they can trust. Be patient. Substance abuse disorders and behavioral addictions are complex chronic conditions, and there's no quick fix to overcoming them. Take care of yourself. The friends and family members of people with addiction often experience stress, depression, grief, and isolation. It's important to take care of your mental health and seek help if you're experiencing these symptoms. Consider joining a support group or organization in your community.
I feel strongly about the power of Al-Anon, a support group for friends and families of addicts in or not in recovery. I would like to share their core principle with you. Addiction affects everyone close to the addict. Changed attitudes can aid recovery. In Al-Anon, there is a focus on the idea that members are not responsible for another person's disease or recovery, and they can find peace by focusing on themselves rather than trying to control the addict. Operative word control, learn how to love and support, not enable or other codependent behaviors. Alanon.org is very helpful for finding a meeting and literature to help us on our journey to peace. Their online bookstore is full of helpful instructional literature for us. Some examples of a holistic body, mind, spirit approach to recovery can include healthy nutrition, yoga, meditation, tai chi, acupuncture, mindfulness-based stress reduction, guided imagery, hypnotherapy, even biofeedback, and progressive relaxation. So recovery both for addicts and those who love them isn't actually a quick fix. Some wish it could be solved with rehab and some pharmaceutical intervention. It is actually a non-linear organic practice, one day at a time for everyone. A willingness to be humbled, to learn and grow, to be courageous and authentic, and also to ask for help.
When should a person see his healthcare provider about addiction?
If you or someone you know you care about or may have an addiction, talk to your provider right away. Treatments and support groups can help. The next slide provides some suggestions.
So, as we hope we have shown, SUD is an extremely pervasive problem, a disease that can affect anybody regardless of their race, their religion, their sexual orientation, their profession, and economic status. Unfortunately, we have a growing shortage of health professionals and a growing number of people of all ages in need of healthcare, including professionals working with addiction patients. In the interest of inspiring others to consider specializing in addiction care, we welcome Nurse Emma, who came here today to share her journey with us.
A few years ago, I took a gap year. I was interested in psychology and wanted to volunteer at our local psychiatric hospital. I was placed in the addiction unit, which disappointed me at first. I figured addiction was the most boring of the psychiatric specialties. But that year turned out to be one of the most important and transformative in my life. We treated patients with a wide variety of substance addictions: heroin, cocaine, tranquilizers, GHB, and, most commonly, alcohol. Our first priority was to make the physical withdrawal process as safe as possible. When someone consumes a drug regularly, the body adapts to its effects. If the drug is suddenly stopped, the body overcompensates, which can lead to potentially life-threatening complications that require medical supervision. But for many of our patients, the clinic served other essential purposes. Addictions rarely exist in isolation. Some patients were struggling with other issues that led to the addiction, like homelessness, chronic pain, mental illness, or unemployment. Others had stable lives before addiction created new problems: fractured relationships, lost jobs, suspended driver's licenses. All of these issues had to be addressed if we wanted to give our patients a real chance at staying sober outside the clinic. We had an amazing social worker who helped with paperwork, replaced lost IDs, applied for insurance, found affordable apartments, and even secured basic clothing. We offered educational groups to help patients understand their condition, and support groups for family and friends facing the impact of addiction. Specialized psychologists met with the patients once or twice a week to address underlying mental health concerns. Since recovery requires far more than just detox, we also fought with insurance companies to secure long-term therapy placements. Over time, I realized our unit served an additional purpose. Many patients seemed relieved and almost happy to be admitted. After dealing with shame about relapses, abusive partners, disappointed parents, or encounters with police, they arrived at a judgment-free place where they could take a breath, sort themselves out, and receive the help they needed. They found community, made friends who understood their situation, and learned how to navigate family dynamics, relapses, and emergencies. After that gap year, I decided to go to nursing school. I eventually returned to the same workplace, this time as a fully trained nurse. As a last thought, I would like to share one of my favorite poems that deeply resonated with many of our patients. Autobiography in 5 short chapters. 1. I walk down the street. There is a deep hole in the sidewalk. I fall in. I am lost. I am helpless. It isn't my fault. It takes forever to find a way out. 2. I walk down the same street. There's a deep hole in the sidewalk. I still don't see it. I fall in again. I can't believe I'm in the same place. It isn't my fault. It still takes a long time to get out. 3. I walk down the same street. There's a deep hole in the sidewalk. I see it there. I still fall in. It's a habit. It's my fault. I know where I am. I get out immediately. 4. I walk down the same street. There's a deep hole in the sidewalk. I walk around it. 5. I walked down a different street.
Thank you, Emma, for sharing your journey and this heartwarming poem. And now, dear audience, it is your turn. Please feel comfortable sharing your story, your concerns, your recommendations. Your thoughts are just as important as anything you heard tonight.
Well, thank you for coming, and feel free to share any thoughts that you may have. And I guess you have to unmute yourselves.
Okay. Jenny Conover, my first time listening to you people, but I had read the script. Thank you very much for allowing me to read the script and attend. I'm a former family therapist that has, of course, worked with addiction, but I think you hit the nail on the head in many areas. First of all, there are not enough. There's a real problem. There aren't going to be enough counselors. We really have to find a way to get more help to more people. The other thing I was going to say that was so real to me is I don't think there's hardly a family out there that has not been affected by this disease. My own family has. My son-in-law lost his daughter to drugs after actually 5 years of being clean. And we all thought, oh, and she overdosed. It probably was a bad, phenolin, and she was gone. So I want to thank you all the people who participated. And again, thank you for having me.
Well, thank you very much for being with us, and we hope next time you'll be participating too.
I hope so. Thank you, Alexis.
You bet. Yeah. Anybody else?
Well, this is Barbara. This was a very powerful script, and the performance, the reading of the scripts was very powerful. The way the personal stories were told, just absolutely the voice of authenticity, and it's just so heartrending. The sense of guilt and shame, and the helplessness you have, and I just and the self-hatred that came across too in some of the stories. It's just very, very strong script, extremely strong script, and congratulations. Thank you to all of you. I mean, my own personal connection is my mother, when in her late 80s, when her spine started collapsing, she was given opioids for pain medication, and it became her addiction. And the physicians, that was the era in the early 90s, before the physicians became more accountable for opioid prescriptions, that they kept fulfilling that. I felt I was helpless against the pain and against the power of what it felt like for her to be pain free through taking opioids. And over time, I saw the effect. I mean, it's hard to know what it might have looked like in another setting with a different kind of pain response, but it was hard to see that.
Yeah. Wow. Thank you for sharing that, Barb.
Yeah, just the whole thing is.
Yeah.
As Jenny said, probably there is not one person in America that has no connection through a family member in some way or shape or form that hasn't had an addiction experience in one way or another. So it's an extremely, extremely powerful presentation. Thank you all.
No. Well, thank you for being with us. Thank you.
Yeah.
Anybody else want to?
I want to say something.
Yeah.
Dina was based on a true person that's in my life. who has had 5 years of recovery, and she's a very, very close person in my life, biological close person. And she's really grown so much, and we're close now, and we were never able to be. And it is a miracle. So I know that it's distressing. And yes, I grew up with a lot of addicts and still have more than one in my life. But I think it's important. And that's why I was glad that I was able to, I was given the opportunity to tell her story of Dina. And she's a real person. And
Yeah.
that's her real story. And so there is hope. And there is a higher power that helps people if they really truly want to surrender. And I've experienced that for myself, and this is a very close person in my life that I'm close with because she's in recovery. And so that's what I wanted to share.
Well, we're very grateful, Carol, that you did share. I mean, we know other people who were just not able to do that, and I understand that. So we're very grateful that you did share that, because your story gives us a lot of hope for those people who are still struggling. Some people just didn't make it, but yours.
Yes, I just think in this world that we're living in right now, with so much that seems hopeless,
Yes.
so much suffering, I do the yes and, of a improvisational actor. It's all there, and as we hold each other uh, through the suffering, that's what I love about you, Alexis, and this group and those that are drawn here, that we care about the suffering, and we care about our own suffering, we care about each other, and I do truly believe that that makes a difference.
Thank you. Couldn't have said it better.
Yeah.
So, anybody else like to say something?
I guess I'd like to acknowledge you, Alexis, for having the courage and the strength and the dedication to do what you did, because I know it's it's very close to your heart. And
Indeed.
it's very painful for you. And it just shows what a giving, caring person you are.
Thank you.
And
Sure.
I'd like to say I was with dear friends what in the moments that they lost their son to addiction.
Yeah.
I saw him grow up with my children and knew him. And to watch the pain that his family suffered. And I think the lesson was just to be there and not to be judgmental, because this can happen. Doesn't matter, the circumstances of one's life. As you said, it can touch everyone. And it's really being there for one another. And if, God forbid, one is lost, for those that are left.
Yeah.
To deal with this. So anyway, sorry.
No. Thank you, Maris. I both know, and very grateful that you were here to share. And Sharon, are you, if you're with us, I just want to thank Sharon for being with us tonight, because he was there the day that I found out about my daughter-in-law. Yeah. So anybody else would like to say something, please feel free.
Just wanted to just thank you so much, Alexis, for writing this very powerful script, and just being able to just even my role, just sharing like some the opportunities for hope and support. I definitely have addiction in my family. I lost my cousin, who was like my sister. We grew up together, to addiction to heroin, and almost lost another relative. But he, by God's miraculous grace, he did survive and is doing very well now. But I was there, during the very dark times, and that he definitely turned the corner and has not looked back by grace of God. But just thinking about my cousin and all that my family went through and my aunt went through, just seeing her just spiral and trying so much to help, and they're very close. So it just definitely hits home.
Yeah. Well, thank you very much for being with us. I kind of felt that there was something very powerful coming from you. Thank you. Yeah.
Thank you.
Yeah.
Yeah, I just wanted to say I think it was one of the best delivered scripts in terms of the performance, and maybe it's because so many people could relate to it. And kudos to you for sharing such a personal story and having the strength to do that.
Indeed. Yeah.
Well, I think for all of us, it's a tribute. And the whole point of this no shame business. And it was my daughter-in-law's mother who for years was kind of hiding it. And when she passed, she said to my son and to all of us, no shame, you know, we're not going to hide it. This is what happened. And we love her. We know she tried. And we have to, we have to, we have to accept what happened, but never forget the beautiful person that she was. And so I felt that this is something I wanted to do. And especially knowing we had people who are not with us today, who are in our group, they simply could not put themselves through it. And I understood that. So it was for all of us. And as somebody said, there isn't a person who doesn't know somebody who's experienced something. And this is what we do. We help each other. Whatever it is, whatever the topic is, we're caring people. And when we unite and hold each other in some way, some capacity, it helps us. We're not alone. Yeah. Thank you. And Kim, I want to thank you for sharing your story. So Kim's story is also very authentic. And thank goodness for people like you. We hope that there are more out there who have the same compassion and understanding. It cannot be an easy population to work with. Oh my goodness. Okay. Thank you, Margaret. I'm so sorry. I'm so sorry that this must have been very difficult for you. I'm so sorry.
It was actually very enlightening, very, very enlightening. And my brother died many years ago, but all through this wonderful, authentically performed presentation, I was trying not to cry. It was so on the mark. I just applaud you and everyone else. I think it is the best performance that I've had occasion to witness. It was just wonderful.
Well,
It was
thank you,
wonderful.
Margaret. Yeah, we missed you with this one because you're so authentic. You're so special. So thank you for coming on today and to sharing something so personal. Thank you. Yeah.
If I may add something.
Yes, please.
My name is Roddy Sorrell, and in 2014, I became ill with necrotizing pancreatitis.
Oh.
And I had surgery, and they removed 3/4 of my pancreas,
Oh
my
my.
spleen, my gallbladder, part of my pancreas, and 3/4. Let me start over. I'm sorry. They removed 3/4 of my pancreas, my spleen, my gallbladder. And from 2014 to 2019, I was in a roller coaster of opioids from the hospital. Now, what makes my story different is that I was never considered an addict. I didn't go to the streets to get my drugs. I went to the hospital, and they were more than happy to keep me happy and filled. It was never discussed that I had any type of addiction. And I was in and out of the hospital for so long. And it wasn't until my 2.5-year-old granddaughter sat on my lap, and I cried that I was going to leave this world because I couldn't take it anymore. And when she sat on my lap, I cried and I cried. And in that day, I knew that I had to change something.
Wow.
And something came into my life that I didn't expect. Someone said that I should try marijuana. Maybe it would help me with my addiction. And it not only helped me, I haven't been back in a hospital since 2019.
Wow.
Since I started smoking marijuana. It changed my life.
Fantastic. Thank God.
It truly did.
Thank God. Thank you so much for sharing your story. My goodness.
Thank you for listening.
Yeah, you look great. You sound great. I hope you feel as good as you look.
You know, it's been a struggle. It really has, but I'm here to tell the tale. And a lot of my family members weren't. My brother-in-law, he died of a fentanyl overdose. He was on methadone. It didn't help. I had a cousin in Pennsylvania. He died on Christmas morning. Fentanyl overdose. His mother found him. He didn't even have a chance to fall to the floor. He was on his hands and knees reaching for something. Died right there. My best friend's son, died of a heroin overdose. It has affected my family more than I could even tell you. And I understand the stories. And my story, I've even written a book about it from what I went through, because my struggle is real and people's struggles are real. And people don't look at people with addiction, like they've said, they're the throwaways. They're the people that, people don't care about. But, my story is, it's not about me. It's about those that are still struggling, that are still here, that are still fighting. That's what my story's about.
Thank you. Thank you. Thank you for sharing your story.
Thank you.
Wow.
Thank you for inviting me.
Absolutely. Anybody else have something you'd like to share or?
I just want to say thank you to everybody for being so authentic.
Yeah.
That Alexis, you've created this safe space for us all to come together to talk about this that affects us all. And
yeah,
it does make a difference when we can come together.
Well, the next one's got to be a comedy, for God's sake.
Good idea.
Anybody who's got a good joke, feel free to send it.
Alexis, didn't you do one like 1776 something
That's our
about?
next one.
Is that the next
working
one
on
you're
it right now.
No, but you already did one also with the
the American Experiment. That was our first one during the beginning of COVID. We had 27 characters. But 1776 is coming back to the Walnut Street Theater. I have the play. I'm going to put a few scenes together, and I'm going to have some people resurrected. John Adams are coming back. His wife, Abigail, Franklin, they're all coming, and they have a lot to say about what's going on with our country right now. So come on back. We'll see you in May, end of May, beginning of June.
Sounds great.
Hey, kudos, everybody. Well done.
And if anybody wants to join us who hasn't performed with us, we can always use your performance. So, well, thank you all very much. And thank you, Daria, Angelic, and all of you, and Taz for offering, and Mark for discovering the problem, and God Almighty for making it happen, because I didn't think it was going to happen. Good night, everybody. Be well.
Care. Well done. Take care.
Good night.
Bye-bye.
Good night.
Okay, bye-bye.
Good night.
Good night. Bye-bye.